My name is Marcy-Youtube.m4v. I'm a physician, an internist and a critical care specialist living in Long Beach, California. I practice in Los Alamitos, California, in North Orange County. I'm the proud president of the American Academy of Private Physicians. We're the patients who work directly for our patients without the interference of government or insurance companies. I'm proud to say that our organization is growing by leaps and bounds. Patients all over the country are becoming more and more interested in a doctor who will work directly for them. And as value-based, personalized healthcare is becoming the growing trend across this country, physicians are finding the need to convert their practices from the more traditional insurance-based practice to what we now know as the not so traditional but much better opportunity at private healthcare, working directly for our patients as doctors in our office, making house calls or whatever is necessary to see that our patients get that extra special personalized care. I'd like to talk to you today about drug switching, something that has come to our attention over the last decade and something that is getting worse, compromising our patients' good health. What we're finding is that pharmaceutical companies and PBMs, that would be other pharmacy benefit managers, are actually changing the prescription that we're writing. They're asking our patients to either get a generic or sometimes to get a drug that is not even like the drug that we prescribed. It's easy for you to understand where that can be dangerous. And particularly for our older patients who are expecting to get the same medication every time they go to the pharmacy, or expecting to get the prescription that their doctor prescribed with the prescribed benefits and potential risks, it is really tragic when our patients get home and find that they're not getting the right pill, that it's not the usual blue pill, or that the side effects of the medication as written on the note given to them from their pharmacist is completely different than what their doctor said. Those of us who are engaged in this kind of personalized health care, and quite frankly, most doctors across the country, don't want to see that happen. We spend lots of time finding the specific drug best for our patients, the one that we think will best serve their specific and individual needs. It cannot happen that a pharmacist is able to change that medication. It cannot happen that a pharmacy benefit manager, you may know them as Medco or Caremark or Express Scripts, there are a number of them. Those people are not your physician, and they should not be able to change your medication. Please be sure when you go to your pharmacist that you ask them, is this specifically the medication that my doctor prescribed? And is this the medication that I've been receiving all along? Make sure that your medications are exactly the same, lest we might find some untoward circumstances or complications, things that you weren't expecting or your doctor expecting. You know, drug switching, unfortunately, has become a national habit. And as the government continues to intrude on your personalized care and on your life, we're concerned that that might become an ever-present potential catastrophe. Work with us to make sure that everything about medicine stays about medicine. And that's the patient-doctor relationship. And that means that you get what you need, what your personal doctor, the doctor you chose, the doctor that's choosing your medical and healthcare strategy, sees that his treatment strategy, your treatment strategy, is specifically what was prescribed. Check with your pharmacist, check with your doctor. When he prescribes Lipitor, make sure you get Lipitor. When he prescribes Avapro, make sure you get Avapro. And if a generic is fine, that's fine too, but make sure that it's always the same generic, the same blue pill or orange pill. Continuity of care leads to better medical care, fewer errors, and a longer life. Thank you so much. And please join the American Academy of Private Physicians this year. Find a doctor who will work for you. Thank you so much. Bye-bye now.